Hello. In this short video, I'll explain what EAV testing is and how I use it in my practice. EAV stands for Electro-Acupuncture according to Voll, named after Dr. Reinholt Voll, who was a German physician, acupuncturist, and professor of anatomy. He used a very sensitive ohm meter to test the acupuncture points on the body. And what Dr. Voll discovered was that the acupuncture points had a different electrical resistance than the surrounding skin. And through meticulous study, he was able to electrically test various acupuncture points throughout the body related to different organs and tissues. And he also showed that the teeth are electromagnetically tied in with the various acupuncture meridians, and thus can affect the whole body. Beyond that, Dr. Voll discovered that one can test a substance, such as an herb, vitamin, or homeopathic medicine, to see if it would balance out the various acupuncture points that were showing a dysregulation. During most initial visits, I use EAV testing to get a baseline on how the body's functioning from an energetic or electromagnetic standpoint. This is a modern twist in what has been used for thousands of years in the Eastern healing arts, where physicians look to the flow of qi within the meridians to better understand what is going on with their patients and how best to treat them. What's important to understand is that qi is not some mystical energy, but is in fact electromagnetic energy. The acupuncture meridians are the circulatory system, if you will, of our electromagnetic energy. Some of you may have heard of or experienced acupuncture, where small needles are used to help change the flow of qi in the meridians. Well, think about it. What are those needles made of? Metal. And we all know what metal is very good at, conducting electricity. But for those of you who just heard me say needles, don't worry. With EAV testing, there's no needles involved. Watch now as I explain and demonstrate what occurs when you come in for your EAV test. Okay, so I'm going to show you what an EAV is, or electro-acupuncture according to Voll. What we do is we test the body's energetic circulatory system. So just like you have a circulation with your heart or your lungs, your respiratory system, your circulatory system, you have your lymphatic system, we have energetic circulatory system known as the meridians. That's where your electromagnetic energy flows through your body. We can test this using an ohm meter, which is right here. It's a very sensitive device. We send an electron down the meridian and we see how the conductance and resistivity is. So we have two brass parts to this, positive and negative. We touch it together. You can hear that we have 100% conductance. That'll show up here on this meter as 100% or on the screen. But if we put a person into the circuit, there's resistance. And we can test very specific points along the meridian. So we use a little water to help the conductivity. Okay? And we're going to touch, for the entire testing, 10 points on the hands, on each hand and each foot to get us our baseline. And then we can go further and explore different meridian points related to different organs or tissues or parts of organs. And this doesn't hurt, there's just a little bit of pressure. And that's what it'll sound like as we go along with the EAV testing. And you're able to look on the screen to see exactly the points that we're testing and where we're looking at. And then we can then search for signals, because everything has a unique electromagnetic signature. So for instance, if we want to look for mercury vibrates at a very specific frequency. If we put that frequency into the circuit and we test, and it balances out where there was a drop on the meridian, that balances out, that's what we call a biological signal analysis, and we have a positive identification of that signal of something like mercury or an infection like Borrelia or Clostridium, you name it. If we have the signal, we can start testing and figure out, is that signal detected? Is it a biological signal analysis of that organ or tissue? And that's how you do EAV. Now that you've seen what EAV testing is, and have gotten some brief explanations on how it works, I want to address questions that often arise when a patient learns about their upcoming EAV test. So how long will it take to get the baseline? The first time I take a test on a patient with the EAV, it can take anywhere from 30 to 45 minutes depending on the complexity of the case. As you heard me explain before, the baseline involves taking 10 readings in each hand and foot so that we can access the main detection sites along the various meridian pathways. If you were to look at an acupuncture chart, you can see that the meridians go from the fingers and toes and along the limbs, the front and back of the torso, and into the head. There are literally hundreds of acupuncture meridians, and the baseline just gives us an overview. Depending on the case, we may explore specific points that relate to an area of concern. For instance, if someone were suffering from brain fog, a common symptom of Lyme disease, then I would localize to a testing point related to the brain, and maybe even get more specific from there. After getting the baseline, I always check the mesenchyme. The mesenchyme, which can also be referred to as the extracellular space, or the space between the cells. That's where the blood vessels and lymph reside. And one of the first problems with a disease process is that an accumulation of the body of toxins and the body not being able to keep up with removing those toxins. But before they can be removed, we have to make sure the mesenchyme is open first. I like to give the analogy that before one does spring cleaning, you have to make sure your windows are open to your house. Otherwise, no fresh air is coming in and the dust just gets kicked up. The mesenchyme is like the windows, and we test to make sure all 21 windows are open. If it's blocked, there are a few homeopathic remedies that works for most patients to help open the mesenchyme before we begin a deeper cellular detoxification process. The next thing I test for are signals of toxins and infections. Everything has a unique electromagnetic signal, or if you think of it like a fingerprint. And we put that signal into the circuit when we are testing an acupuncture point, and that substance is somewhere along the meridian, it will change the conductance from the previous baseline. So where previously there may have been an indicator drop, now it no longer exists. Without going into too much more explanation, just understand that we can tell if a signal is there or not. And I like to refer to this type of testing as biological signal analysis. We can then quantify how strong or weak the signal is by testing the equivalent X potency, where 1X is like a 10 to the minus 1, and a 20X is like a 10 to the minus 20. So the larger the number in front of the X, the more dilute or weaker the signal is. So if we were to look for something like, let's say, Borrelia burgdorferi, the bacteria-associated Lyme disease, and we found that signal in a particular area at, let's say, 5X, I would say that that signal there is quite strong. Now comes the big question. Does that mean you could diagnose me with Lyme disease using the EAV, doc, or some other disease or infection? The answer is a big no. I use the EAV tool to help better understand what's going on with the patient and what might help them. This may lead to further testing with other methods, such as like blood testing, or trying certain therapies or medicines. Having used this in my practice for over 15 years, I have to say that biological signal analysis with EAV has proven to be quite accurate. But just like anything, there are false positives and false negatives. But it's an amazing tool to help those practitioners that know how to use it properly. I hope this video has given you a better understanding about EAV testing and what you can expect when you come in for your visit. I look forward to seeing you soon.